Hello, hi, and namaste. Welcome you all to our new episode of Health Heroes of India. Today, as a hero of our Health Heroes of India, we have invited our chief guest, Dr. Siva Sankar Dalai. Dr. Siva Sankar Dalai has a vast experience in the field of neurovascular intervention surgery. So, he has practiced more than 20 years of experience in the field of neurovascular intervention. Let's welcome him to our podcast and discuss about the non-healing ulcer of the lower limb. Sir, welcome to our podcast.
Namaskaram.
Thank you. Sir, could you tell me something about yourself, how you started this practice and since how many years you are here in Vishakhapatnam?
First of all, I would like to congratulate you for conducting such a program.
Thank you, sir.
You are bringing doctors to the public foray. It's a fantastic thing because somehow the relation between the doctors and patients, they have suffered of late. Now it's time that the doctors and patients should come together.
Yes.
They should know each other well beyond the hospital so that the patients are at comfort whenever they are going to a hospital for a treatment. So nowadays we say that we don't treat a patient, we don't treat a disease, but we treat a human being.
Yes.
So to treat a human being, we should have a social side of it. So I really am happy and congratulate you and your team for bringing out such podcasts.
Thank you, sir. Thank you, sir.
Regarding me, I came to Vishakhapatnam in 2007. I was working with Seven Hills Hospital since 2007 to 2020. 2020 onwards, I am working in Medicover Hospital at Vishakhapatnam. I operate all across the country. I am a proctor for many companies. Whenever there is a complex vascular situation, I go and operate from Srinagar to Tamil Nadu, from Raipur to Bhubaneswar to Bombay to Kolkata. Everywhere I have operated.
So many cities.
Yes. And across the northeast, in Imphal Heart Center, Shillong, everywhere I have operated for complex vascular issues. And if you look at the topic today, the non-healing ulcer of the leg is a very common issue.
Yes, sir.
If you go in the road and observe 100 people today, you will find vascular issues in the leg, at least in 5 of them.
Yes, that's true.
So vascular issue means, so there are 2 types of blood vessel in the leg. One is artery, which brings the pure blood to the leg. One is the vein, which takes back the impure blood from the leg towards the heart.
Yes.
So there can be an arterial problem, there can be a venous problem. If I speak in Telugu for our audience here, so Damanalu, Siralu. Damanalu manchu rakta kalki vastundi, cheedu raktam siralu paina potundi. So there can be a problem in the artery, so the pure blood coming to the legs get compromised. Or siralu problem unte, cheedu raktam constant ga stuck అయిపోయి problem అవుతుంది. So there are 2 groups of vascular issues in the leg.
Yes.
Arterial problem, Damanalu problem, siralu problem, or the venous problem.
Yes.
So this is an overview of the disease.
So basically, you could tell me something about what is basic non-healing ulcer, how it starts.
Absolutely. So non-healing ulcer, in Telugu we say it's a pundu padipindi. So non-healing ulcer means an ulcer in the leg which is not healing for 6 weeks or more.
Okay.
With all your medical efforts.
Okay.
ఎంత ట్రై చేసిన తర్వాత కూడా మీ అల్సర్ హీలింగ్ రాదు ఫర్ 6 weeks or more, then we call it as a non-healing ulcer. ఇది non-healing ulcer can happen because of arterial problem or venous problem. For example, suppose there is an arterial occlusion, block అయిపోతే దమనలు మంచు రక్త కాల్కి రాదు. Once that happens, the person will start having ulcer, pundu.
Yes.
So generally, if I give you a life example, diabetic patient, చాలా మంది diabetic patient you have seen where they have an ulcer in the leg which is not healing. They are trying their best, all kinds of antibiotic, all kinds of ointment, but pundu clear రావట్లేదు. Non-healing ulcer. Why? Because in diabetes, what is happening is there could be an arterial problem, so pure blood is not coming to the leg.
Yes.
There can be a diabetic neuropathy. దాని గురించి కాల్ సెన్సేషన్ తక్కువైంది. కాల్ సెన్సేషన్ తక్కువైంది. ఫర్ ఎగ్జాంపుల్, యు ఆర్ పుట్టింగ్ యువర్ లెగ్ ఇన్ అ హాట్ సర్ఫేస్, యూ విల్ టేక్ అవుట్ యువర్ లెగ్ బికాస్ యూర్ ఫీలింగ్ హాట్. బట్ మీ సెన్సేషన్ తక్కువ అయిపోతే ఈ హాట్ సర్ఫేస్లో యూ విల్ నాట్ ఫీల్ ఇట్ అండ్ యూ విల్ ఇంజ్యూర్ యువర్ లెగ్ బికాస్ ది పెయిన్ సెన్సేషన్ ఈస్ గాన్. Because pain is a protective phenomenon.
Yes.
Once that is lost, then obviously you are going to hurt yourself.
You don't know. You don't feel anything.
You
while
don't
walking.
feel that you're getting hot.
Yes.
All right. So I gave you an example. Non-healing ulcer, that means the legs ulcer, pundu, that can happen because of arterial occlusion, as happens in diabetes. Number one, most common cause, most significant cause in India, because India is a diabetic population of the world, diabetes capital of the world. చాలా మంది డయాబెటిక్ పేషెంట్ ఉంది, దానికి ఆర్టరియల్ డిసీజ్ ఉంటే, డయాబెటిక్ ఆర్టియోపతి ఉంటే, దే విల్ హ్యావ్ a non-healing ulcer which will not cure.
Yes.
Number one.
Yes.
Number two, smokers. People who smoke a lot, they suffer from a disease called Burger's disease.
Burgess disease.
Burger's disease. That is a vaso-occlusive disease. దమనలు slowly thrombose అయిపోయి atherosclerotic situation అయిపోయి block అయిపోతుంది.
Okay.
So young fellows, they have come to me. I am just remembering one fellow from IIT Chennai, very bright student and all that. And he was a smoker. He was working in Dubai and came with a severe peripheral arterial disease because of smoking itself. All right. And then, so I told you diabetes can cause arteriopathy. So
One is
ulcer.
smoking.
I told smoking, which can cause Burger's disease, so that the arteries get occluded and there's an ulcer which is not healing. Then I'm telling you about atherosclerosis. As the age progresses, once people become older, if they are not active, not doing exercise, the cholesterol plaque get deposited in the artery. దాని గురించి కూడా దమనలు బ్లాక్ అయిపోయి, so there can be an ulcer which is not healing. So it's an atherosclerotic occlusion. Number four, calcific occlusion. We see a lot of patients today, nowadays, there is a calcific occlusion of the blood vessel. Calcium deposit అయిపోయి blood vessel block అయిపోతుంది.
Okay.
So number five is వేరే ఒక ప్లేస్ లో clot అయిపోయి, that clot migrate అయిపోయి కాల్ block అయిపోతుంది. So there is a clot in the heart, for example, that gets embolized. So we call it as a thromboembolism, because the thrombus is formed in the heart and it moves towards the leg with the flow of the blood. We call it as a thromboembolism. Embolism means migrated from somewhere else.
Yes.
So that thromboembolism can occlude a vessel, which can also be a very critical issue where patient gets acute limb ischemia. But chinna clot unde, small clot, they will go distally, they will cause an ulcer which is not healed. So I told you 5 different regions where the patient will have an ulcer because of arterial
Problems.
దమనలు ప్రాబ్లం గురించి, diabetes, smoking, atherosclerosis, calcification, and thromboembolism. These are the 5 causes where the patient can have an ulcer which is not healing.
Yes.
Then come to the venous side, సిరాలు problem. So suppose you have good arteries, మంచి రక్త సరిగా రాదు, very good flow of arteries there, but suppose the patient is having varicose vein, suppose the patient is having deep vein thrombosis, suppose the patient is having PTS, post-thrombotic syndrome, then again they will start having the problem in the leg.
Okay.
So most common ulcer which is not healing are diabetic because of arteriopathy, and second one is varicose vein, where there is a non-healing ulcer of the leg because of varicose vein. What is varicose vein? Varicose vein means మంచు రక్త కాల్కి వస్తుంది, చెడు రక్తం పైన పోలేదు. So the good blood is coming to the leg, the impure blood, the venous blood is not able to go up. Hence, the venous blood is getting deposited in the leg, and that's the reason the ulcer is not healing. Because for ulcer healing, we need good blood.
Yes.
All right. Second is DVT, as I said, deep vein thrombosis. ఏమవుతుంది, 2 రకాల సిరాలు ఉంది కాల్కి, సూపర్ఫిషియల్ వెయిన్, డీప్ వెయిన్. డీప్ వెయిన్ లో క్లాట్ అయిపోతే we call it as a deep vein thrombosis. So once there is a DVT and it is not recanalized and treated early and absolutely correctly, patient will go to PTS, post-thrombotic syndrome. So that will cause swelling of the leg and the ulcer which is not healing. So these are the primary causes, vascular causes of non-healing ulcer. Non-vascular cause can be osteoarthritis, bone infection, cancer. These can also cause non-healing ulcer, but they are less. If I see 100 patients who are having an ulcer in the leg which is not healing, 90 will be either arterial or venous. Another 10 could be because of injury, infection, osteoarthritis, cancer, abscess, all those things.
Okay.
Yes.
So maximum patient those are suffering with non-healing ulcer, they are only due to these venous problems.
90% will be either arterial or venous problem.
Venous problems,
Yes.
and the 10% only is the other causes.
Non-vascular problem.
Non-vascular issues. Yes, thank you, sir. Sir, as you told that our India is right now the state of diabetic capital. So the diabetic has increased. The people, those who are suffering the diabetes, that is increased. Who are in the diabetes or in other aspect also? How many patients are suffering with diabetes, and in the society, present society, what are the risk factor for that non-healing ulcer will affect in our society?
See, first of all, people who will get affected by arterial or venous disease are at risk of having non-healing ulcer. Now, let us understand who is at risk of having diabetes or varicose vein, because these are the two most common cause of non-healing ulcer we see in day-to-day practice.
Okay.
So, if you are at risk of having diabetes, or if you are having a risk of varicose vein, you are the same person who will have the risk of having non-healing ulcer. Let us start with the arterial side. Now, we know diabetes is a metabolic disease. So, sedentary lifestyle, then hereditary. If your parents have diabetes, you can have diabetes. And sedentary lifestyle, a normal person who is not doing exercise and onto junk food, overweight, they can have diabetes. Even now it is known that stress can also cause diabetes. So if you are having stress, having obesity, not eating well, not doing exercise, you are having a risk of having diabetes and subsequently a non-healing ulcer. Now, the group of varicose vein, who will have varicose vein which can lead to a non-healing ulcer? People who stand for long hours, like a traffic police, a surgeon, a bus conductor, lathe machine worker, civil contractors, housewife who are standing and cooking for long hours, and all other type of civil workers who has to stand for long hours. They have a risk of having varicose vein. Number 2 group, ladies who get pregnant can also have varicose vein. 15% of the people, 15% of the women who will get pregnancy will get varicose vein, which will need some kind of medical attention.
After the pregnancy, after the baby delivered, problem will get resolved?
70% of the people who have varicose vein during pregnancy, after the baby's birth, they become normal.
Okay.
Another 30%, that means around 4 to 5% of the ladies who become pregnant will have varicose vein, which will need medical attention. They will not get automatically cured.
Okay.
So a group of people who stand for long hours, a group of ladies who become pregnant, and another group of people who sit for long hours. Like in banking, like in software, they sit for long hours and the venous drainage from the leg is impaired, leading to varicose vein.
Okay.
So these are the 3 group of people who can have varicose vein. And if you are not taking adequate care of varicose vein, you can have venous ulcer.
So the people those who are standing for long time or sitting for long time, because that their job demands that.
Professional requirement.
Professional, yes. So on that case, what's your advice for them so that they will not suffer with that?
Exactly, that's a very good question. Now, for example, now you have a traffic police who has to go and stand long hour in the traffic. We cannot say that you don't stand. But how to prevent varicose vein in them? You should wear a pair of stockings, class 2 compression stockings, which will help the circulation of the leg. So that is the first recommendation, that if your job demands long standing and long sitting, you should prefer to use a pair of stockings. Number 2, exercise, especially leg exercise. We tell them to do a supine cycling or a kind of sit-ups, and then we tell that tiptoe exercise.
Yes.
So for example, if you have to stand for long hours, sit for long hours, if you do 3 days of cycling for half an hour, you will not suffer varicose vein, most likely, because you are improving your calf muscle, which is responsible for bringing the impure blood up
to the heart. Yes.
So if your job demands prolonged sitting and prolonged standing, you better strengthen your legs by regular exercises and pair of stocking when you have to stand for long hours. That will prevent this varicose veins.
So for like software persons or banking person, those who are sitting for long time, in that case also they can go for stockings.
Yes, they can wear stocking and go to the office and sit.
Okay.
And the best recommendation is exercise.
Okay.
If you are regularly exercising, you will not have varicose vein.
Okay.
You are not able to exercise, you will have to wear a stocking if you have to stand and sit for long hours. Another cause is obesity.
Okay.
If you are not maintaining your body weight, you are becoming obese, more and more stress on your legs, that can cause varicose vein. So better contain or control your body weight, maintain a good physique, do exercise, that will prevent varicose vein also.
Sir, few times before you told that stress also factor which leads to ulcer or something like that. You told.
No, I told that stress can lead to metabolic disease like diabetes.
Diabetes.
Yes. Diabetes is a cause of non-healing ulcer. Stress can cause metabolic disorder like thyroid disorders, like pituitary disorders, like hormonal disorders in female, and diabetes. All this endocrinological disorder can happen because of stress, because stress will release a set of negative hormones which will rattle your equilibrium of hormones. That is how you start having these endocrine problems and metabolic disorders.
Yes.
Actually, if you are very fit, suppose somebody has diabetes, he becomes fit by doing exercise and contain the diet, and mostly it will be controlled because it's a metabolic disease.
Okay.
Don't sit on diabetes as if it is a gift of God or gift of your parents. You got hereditary, so you have to have diabetes, you have to have medicine, you have to have insulin. No, you should get over them by doing proper exercise and maybe some meditation, yoga, and ideal body weight maintenance and exercise. You will see that your diabetes will be very well controlled, and all type of endocrine disease will be controlled by regular exercise, ideal body weight, and stress management by yoga and meditation.
Right.
This will do wonderful to you.
So many people, those who are suffering with diabetic foot ulcer, every day I used to come across 3 to 4 patients, 3 to 5 in between, a non-healing person and a non-healing ulcer. On that we have to offload our duty is to offload the particular ulcer area. So on that case, if there are some people, what they ask me a question, sir, after ulcer, you just do offloading. After offloading, shall I go for the medicines what he has given by the doctor, or should we stop? So on this content, what's your advice for this?
Offloading is a very, very important area to heal the ulcer. What do we mean by offloading is, suppose in the feet there is an ulcer, we want the ulcer should not be in contact with the shoe or the ground.
Yes.
For example. So we create a hole or create a space and we support it all around so that it has adequate air and not touching anything. So that itself is a good idea to heal the ulcer from outside. But what about inside?
Inside, right.
So you have to rectify your vasculopathy, your problem where the good blood is not reaching the ulcer, by doing an angiogram, if required angioplasty, or with medication if it is an early stage like celestazole, like the blood thinner like ecosprin, clopidogrel, and some painkiller. Those will help, and the healing can happen when the good blood is rushing to the ulcer because of the antiplatelets like ecosprin, like clopidogrel, like rosuvastatin anti-cholesterol medicine, and the celestazole and the Trental. They will help the improvement of microvascular circulation where the blood flow improves to the ulcer and the ulcer starts healing. If the problem is more and more into the major vessel, it might need an angioplasty if required, a placement of a stent in the leg arteries, like we do it in the heart arteries.
Sir, non-healing ulcer, once the ulcer start, it will be healed or not. Depending upon that, we'll say it is a healing ulcer or non-healing ulcer. But before ulcer, then maybe some symptoms patient should feel. So could you explain what kind of symptoms a normal person will get before the ulcer?
There is no such symptoms as such in a patient to have non-healing ulcer. But as I said, that if you are a person who can have a risk of an ulcer, like you are diabetic, like you are a smoker, like you are varicose vein patient, like you had a DVT or PTS, post thrombotic syndrome, then you are a person at risk of having an ulcer where you should take care. Take your medications better, take care of your legs, and if you have a problem, visit your doctor. And as we said, that if there is an ulcer because of injury or spontaneously there is an ulcer which is not healing for more than 4 to 6 weeks, then immediate attention is required. Initially, probably you can do a little bit of home remedy, some ointment, dressing, bandage, and most of the time it heals. If it is not healing, then you should visit your doctor for evaluation that what is the underlying cause of this ulcer which is not healing, whether there is any arterial problem, there is any venous problem, and otherwise if there is any other non-vascular problem.
What I'm talking, sir, what I'm asking you, in the plantar surface of the foot, if they'll feel some kind of hardness or something like that,
Okay.
I'm talking about that.
Okay.
I'm asking about that.
Okay. So the first thing is that if you're not able to feel the senses, that is the first sign that you are going to have an ulcer, because you lost the sensation of pain. Okay. Second, if you have some kind of hardness or scaly surface of the skin is becoming scaly and hard, the next stage is it is going to get an ulcer. And of course, if you have recurrent infection, then that is also a cause for ulcer. Especially these are true for a diabetic patient, because the varicose vein patient will have an ulcer over the malleolus, not on the plantar surface.
Yes.
It is high up, either in the medial malleolus or lateral malleolus. How do you differentiate that this ulcer is arterial or this ulcer is venous? Very important.
Yes.
So if you see a patient who is having an ulcer on the foot, the plantar surface of the foot,
yes,
it is definitely arterial problem, most likely a diabetes or because of neuropathy as in leprosy or other disease where the sensation is very less, hence you hurt yourself.
Yes.
So plantar surface is arterial, never vein, and sometimes because of neurological problem, the sensation is less, as I said in leprosy.
Yes.
In leprosy, your ulcer is not because of lack of blood supply, but it is because of the neuropathy. Diabetes also we have discussed about 3 things: the arteriopathy, the neuropathy, and the vasculopathy, and the lack of sensation, which can cause an ulcer, the lack of blood supply, which can cause an ulcer, and
the lack of if the impure blood will not go to the heart, and
that is the varicose vein symptom. So
yes,
basically 2 things in diabetes which causes an ulcer: arteriopathy and neuropathy. And in varicose vein, impaired venous drainage causes the ulcer. So as we are discussing, in the plantar surface you have an ulcer, that is because of lack of blood supply, good blood supply. But if the ulcer is high up, all the way up to the middle of the leg or ankle, then you will think it is the venous problem. Next, suppose the patient is having ulcer over the toes.
Or the toes.
Toes.
Yes.
This is an arterial problem.
Okay.
So venous problem, venous ulcers are mostly confined to medial malleolus, lateral malleolus, sometime on the dorsal surface of the foot. It never goes to plantar surface. It never affects the toes.
Okay.
So that is how we differentiate. And in venous ulcer, you will see additionally that the leg has become black above the medial malleolus.
Okay.
Or the lateral malleolus. Whereas in arterial disease, the toes become black, which we call as a gangrene. Okay. So if a person comes to us with an ulcer on the plantar surface or blackening of the toe, it is an arterial problem, diabetic arteriopathy, pregangrenous stage or gangrene. But if the patient has a good foot, but the area of the distal part of the leg, the medial malleolus, lateral malleolus has become black and there is an ulcer over there, it's a venous ulcer.
So for both cases, treatment will be different.
Treatments are different, yeah.
Yes. Sir, when a patient comes to, how do you diagnose them and what are the diagnoses as involved or tests are involved?
So as I said you now, so when you are seeing a patient who is having an ulcer, by clinically looking at the ulcer, most of the time we have diagnosed that it is an arterial or a venous problem.
Yes.
Because of the anatomical distribution, look of the ulcer, and even smell of the ulcer. The venous ulcer smells differently than arterial ulcer. Because we are seeing them for past several years, we know how the different ulcers will smell. So That's typical sore smell from a venous ulcer, and the arterial ulcer smells entirely differently because it is mummification. If it is a dry gangrene, if it is a wet gangrene, it is like a very purulent smell.
Okay.
But those purulent smell, pungent smell will not come from the venous ulcer. They will be sour smell. So clinically you see it, for example, and you have differentiated, you are dealing with arterial or venous ulcer. Then comes the test with your clinical suspicion. Suppose you are thinking that it is an arterial problem, the first thing you can do is a clinical examination
Yes.
to look for the pulses, the dorsalis pedis, the posterolateral pulses, and then you can ask for a Doppler test. Duplex scanning or Doppler test, color Doppler test is something that is very, very sensitive to find out what is the problem. Is it an arterial problem or the venous problem?
I just want to interrupt you here, sir. Many people, as they're going for Doppler test, so many patients have their questions: "What is Doppler test and how it gives the result? How you want to
Absolutely.
know?" So, could you please explain?
Oh, yes. So, what is basically Doppler test? Like, for example, we have read Doppler's phenomenon when we were students. What they say is, suppose you are standing by the side of a train track.
Okay.
Train is coming towards you, blowing the horn.
Hmm.
So, as the train approaches you, the sound of the horn will be increasingly heard by you. And as the train moves away from you, the horn disappears.
Yes.
Okay. So, like that, in Doppler test, what we do is that we put a probe of ultrasound Doppler, which has piezoelectric crystals. It will just throw away sound waves.
Okay.
Ultrasound, like we have a sound wave which is an audible sound wave, and ultra or infra means if it is below the frequency of that sound, we call it as a infra wave. If it is beyond the audible range, we call it as an ultrasound.
Okay.
All right. So we will send sounds with higher frequency which is not audible to the human ear.
Okay.
That sound will go and reflect back into that probe.
Okay.
The piezoelectric crystal will emit the sound and also receive
This
the
is the
sound.
sound.
So it will just tell you that how fast something is moving, number one, and which direction it is moving, depending on the kind of wave we get it from a reflection. So as we do a Doppler, we send sound, we receive back the sound, and that sound will tell us that what is there in between. Either it is moving rightward or leftward, upward or downward, how fast is it moving, is there any obstruction. All these things we will interpret through the reflected sound, which is done by the computer, which we have to read it out. That is called ultrasound.
Yes.
So once we do an ultrasound Doppler, we will come to know whether there is any blockage of the blood vessel, how is the flow in the blood vessel, how is the waveform in the blood vessel. That will tell us exactly how healthy is the blood flow inside the artery. Anatomically also in Doppler, in ultrasound, we can see how healthy is a vessel wall.
Yes.
Okay. So when we suspect a vascular problem, either arterial or venous, first thing we say is Doppler because it is non-invasive and it is simple and it is effective, widely available, less costly. So we do an ultrasound Doppler which will tell us what is the problem. Suppose ultrasound has told us something which we are not satisfied with or we want more information, we do an angiogram. Angiogram.
Okay.
In angiogram, basically there are three types of angiogram. One is a CT angiogram done through a CT scan. One is an MRI angiogram. So MR angiogram is done through an MRI. And there is a DSA angiogram, which is a digital subtraction angiogram, which we do inside a cath lab. So three types of angiograms are available. Depending on the situation of the patient, we will advise angiogram. And once we have an angiogram, we will get a clear picture that where is the problem. One artery is involved, many arteries involved, short segment, long segment, whether there is a block, there is no block, everything we will clearly see.
Okay.
And the difference between CT MR angiogram and DSA angiogram is CT or MRI angiogram will take a spot film to tell us that where is the block, how big is the block. In digital subtraction angiogram, we will give contrast and follow it down. So it will also give us a physiological idea that how the flow is apart from the blockages. So these are the type of angiogram we do when we suspect there is an arterial problem which is not adequately identified by ultrasound.
Okay.
So ultrasound Doppler and angiogram are the test for evaluating the vascular tree of the leg.
So that depends upon the severity of the problems.
Severity of the problem, yes.
Okay.